25 years ago, I wrote a book, Marketing Strategy in the Pharmaceutical Industry, and we have now decided, together with Edouard de Mera, to write a new book. Why this new book? Because we think that although marketing, the key principles of marketing are still the same, you still have to segment your markets, you have to position your products, and you then have to implement that strategy via the sales force and various other marketing mix elements. But what has changed is that the world surrounding the pharma industry is changing. We have our own views, and we would like to share those with you. And we think that there are two types of changes. There is continuous change, as there is in any industry, and then there are some disruptive changes that we think have a big impact on the environment in which marketing and sales has to operate and contribute to the pharmaceutical industry. So in terms of the less path-breaking changes nonetheless, but less fundamental, we think that, as some people would argue, it's getting more competitive in the industry. Well, we don't know of any industry that gets less competitive. This is just the nature of business. Any industry over time gets more competitive, and managers have to deal with that. Some people would argue that there is more importance in the future on the scientific evidence and outcomes in the pharmaceutical industry. And we're not arguing with that, but we think that that is just a continuation from the past. Scientific evidence and outcomes have always been important, and they will continue to be so. And as a matter of fact, as there will be more emphasis on scientific evidence and outcomes, it will become even more important for marketing and sales to distinguish and pick up those pieces of evidence that are useful in communicating the advantages of the product offerings that the company is bringing to the market. Some people will argue that generics are becoming so crucial in the industry, and in some cases generics and biosimilars. We believe that over time this has always been the case. Since the early 80s, generics have always played a big role. It's a little bit unclear how biosimilars will develop in the future, but we think it's not a fundamental change in the industry. It is a continuous change that managers have to take into account. Some observers argue that the pharmaceutical industry will not be able to continue having high prices that will allow them to secure profitability that is expected by the financial markets. We believe that there's always been pressure on prices, and the pharmaceutical industry has been able to adjust to those constraints, and as a matter of fact, the pharmaceutical industry has managed these constraints very well, and their profitability has not decreased over time. For some companies it's been more difficult than others, but in general the pharmaceutical industry has been able to cope with price pressures quite well over time. And then, of course, in this day and age where everything is the internet and how the internet changes all industries, some people will argue that the internet and social media will fundamentally change the pharmaceutical industry, and in particular how you do marketing and sales. Of course, we would not disagree with the fact that the internet and social media will have an impact on how the pharmaceutical industry communicates with their various stakeholders, but we don't think that it's going to change the way that you look at marketing and sales in a very fundamental way. Internet and social media is a new channel that will add value and that will change the way that companies will communicate to their various stakeholders, but it is a continuation rather than a disruptive change. It's a new channel that opens up and that pharmaceutical companies will have to pay attention to, and it gives new opportunities as such. So what we do believe are more fundamental changes in the industry with significant implications for how you look at marketing and sales going forward in the industry are, first of all, the fact that many non-prescriber stakeholders will become absolutely vital in the industry. It is a change in mindset that will be necessary to understand not just the prescriber, but various other stakeholders in the industry. And this is a very big change that marketing and sales will have to cope with. It has implications because we now have to understand not just the prescriber, but we'll have to understand much better various other stakeholders like pharmacists, like nurses, like patients, patient organizations. And what is an additional difficulty here is that all these various stakeholders might not have the same needs and wants. And somehow we in marketing have to find a way to communicate our product offering to all these stakeholders with all their different needs and preferences. And we have to build a consistent and coherent story that will satisfy all of them. Major fundamental shift. It is a fundamental shift as well in the sense that we move away from the standard relationship between a sales rep and a prescriber to a situation where we're going to have to manage various stakeholders via account management and other forms of organization of the way that we communicate with these various stakeholders. A second fundamental change, we believe, is the opportunity from emerging and developing markets going forward. Now, this doesn't mean that these emerging and developing markets are going to be the panacea for pharmaceutical companies and that will allow them to grow faster than in the recent past. No, we believe that there are new opportunities there. There is going to be increased volatility. They're not going to be growing. They're not going to be equally attractive each year. There are various risks involved in going to these emerging markets. But we have to understand in marketing and sales the new reality that these emerging markets bring. And thirdly, we believe that there is another fundamental shift with huge implications for the marketing and sales part of the organization and the company in total is we're moving away from the center of gravity of the industry being aimed at huge primary care markets to more niche specialty care markets. I think it's a huge difference that marketing and sales has to cope with. It's going to imply different business models where we're going to have to think about how do you become and how do you sustain profitability in niche markets. And we're going to have to get sensitive to the new idea of personalized healthcare in these niche specialty markets, where we're going to have to manage not just bringing products to the market, but where we're going to have to think in three dimensions: products, biomarkers, and diagnostics. And it's that combination is called the personalized healthcare that has very important implications for marketing and sales.